Hello, my name is Nez Camarena. I'm a patient of Dr. Gorgas. Well, if I could tell you my story, September 23rd, 2015, I injured my shoulder pretty bad in the water. I was careless and I got knocked down by a wave. I dislocated my shoulder, and coincidentally, the second wave relocated my shoulder. It was a very painful thing, probably one of the most painful things I've ever had to experience. At the same time, I didn't know it at the time, but I had degenerative lower back discs. My discs are dehydrated, they were compressed. That was one of the reasons why I basically collapsed in the water and became immobile, and just a series of very uncomfortable.
Weren't you having trouble
situations.
getting in and out of the car prior to going in the water?
Yes, I didn't know
because
that
of the
I
low
had
back?
that.
Yeah.
I just thought that I'm 52 and I just figured, well, I guess this is what it's like getting old. But no, it's not. So September 23rd, we're November 8th or 9th, and my lower back is completely pain-free. It has been for a few weeks. Dr. Gorgas is continuing the treatment, and I've never felt better. I'm able to live a normal back functioning life. If that makes any sense. Free of pain, because I did have chronic pain.
What do you think of the spinal decompression machine that we put you on to decompress that low back, that disc?
For some reason, I actually enjoyed being stretched because you can't do it yourself. It takes a machine to do it. I know hanging upside down is similar to it, but that machine is comfortable, relaxing. Mm-hmm. I'd fall asleep. Sometimes I'd catch myself snoring. I look forward to getting on it. When I'm off of it, I'm going to miss it. The treatment I highly recommend. I sit on the couch while I'm watching my favorite TV, and I wonder, is that pain coming back? And it never came back.
All right.
So, like I said, I dislocated my shoulder. I have 9 torn muscles. I couldn't move my arm. I was pinned up like this when I met Dr. Gorgas the day I met him. I had fever. I was just in bad shape. Immediately I was going to go into surgery. But now I can move my arm, my fingers. I'm not 100% there yet, but I expect to be. So do I recommend the lower traction? What's it called?
It's spinal decompression.
I highly recommend it. It's something that I should have done many years ago. I didn't know it existed.
Yeah.
Had I known it existed, I would have done it. Do I recommend Dr. Gorgas? Absolutely.
Hey, Nez, let me ask you something. In the process of you being here with us, you also got curious and we did some blood work on you. And do you care to share a little bit about what we're doing and how you're feeling as far as sleeping, as far as losing weight, as far as brain fog, energy, etc.?
Yeah, not at all. So he recommended that I did some blood work. One of the immediate things that I did was to rush over to the center, and we got the blood work back, and I just saw in bold black letters in more than 10 spaces, I'm embarrassed to tell you, more than 10, high, excessive high in cholesterol, high in, my liver count wasn't looking very good at all.
High in glucose.
High glucose, iron. So he put me on a program. And at first I said, how am I going to swallow all of these pills? After 2-3 days I got used to them. I'm still taking them. I take his powders. I take them as recommended. And I've lost 8 pounds. I don't fall asleep during the day. I have lots of energy. I'm able to sleep. I haven't even had a slice of pizza, as a matter of fact, since I started taking them. I don't crave it.
Now that was just 2 weeks that we're into this, right?
No, doesn't time
go by fast?
Go by fast.
Yeah.
I looked up at the bottom of the pills and I said, my gosh, what's going on? 2.5, maybe going on the 3rd week.
Yeah. And you're seeing the results
I saw the
already.
results after the third day, because if I may, in a clinical setting, I had a normal bowel movement, and urinating, and all of that stuff looked normal, and I said to myself, boy, I was a mess. I knew I was in denial. I didn't want to read my chart. But do it. You have to read your chart. You have to give blood. You have to have your blood read so that you could live longer. So now I feel like I have something to take with me. I live in Arizona, and I'm going to take this information to Arizona on for the rest of my life.
Right on.
And what can I say? Don't be afraid of the blood work. You got to do it. And if you don't, you're in denial.
Great. Thank you so much.
You're very welcome, Dr. Gorgas. It was
It's been
my
a pleasure.
pleasure.
You bet.